All right, it appears to be 2 o'clock on Monday, October 11th, 2021, so we will call the meeting of the Safe and Healthy Schools Commission to order. Our first item is item 1.02. It's our roll call, America.
John Balaam, Ivy Batmale, Scott Benton,
I'm here.
Lorraine Benuto,
I'm here.
Charlene Bybee was not going to be able to be present today. Liz Flores should be joining us shortly. Okay. Jessica Gokachia,
Here.
Amber Joyner,
I'm here on the phone.
Leanne McCauley,
Leanne McCulley Larson is here on the phone.
Peg Samples,
I'm here.
Natalie Sanchez, Misty Von Allen.
Here.
Roll call has been taken.
Thank you so much. And we are going to move into item 2, which are our items for presentation, discussion, and information and/or action. Public comment, any individual that may address the Safe and Healthy Schools Commission concerning any action item listed below. A completed citizen's request to speak card should be filled out and submitted before speaking during public comment section, which must at least include the name of the speaker. Prior to any action, the committee chair will invite the individual to come forward and speak. Today's meeting is being held via Teams and as well as in person, so I want to make that known that we have a few of our commissioners joining us via Teams. And we will move into item 2.01, which is introduction of new commissioners. Dr. Lamarca.
I thank you. For the record, Paul Lamarca, Chief Strategies Officer. I'm not sure we actually have any new commissioners. Peg, you attended one meeting.
This is my second.
Right. We are kind of a pretty new team, and we do have 3 vacant spots at this point. Dr. Patterson had to resign her spot, and then we have a couple of other spots that we need to fill, and we've got an active application process. But probably what we ought to do is introduce Andrea Schulwich. Is that the right way to pronounce your name?
That's correct. Yes, Shulowich.
So Andrea is new with the school district, and I believe she's going to be our legal representative as part of this commission.
That's correct.
Awesome, welcome. And just for those of you out there, this is one of our, I think it's our second in-person meeting, so with the mask, I don't recognize you because on Zoom, I can see your face. So thank you guys for joining us both by Teams and in person. Item 2.02 is the action to adopt the agenda, and this is for possible action. So I'm going to put it out to the commission.
I make a motion to adopt the agenda.
Thank you, Dr. Benuto. Is there a second?
I second that.
Thank you, Jessica. And with that, we have a motion and a second. Is there any public comment on this item? Hearing none, we will take the vote. All those in favor, please signify by saying aye. Aye. Any opposed? Motion carries. We will move on to item 2.03, which is the discussion and action to select a committee chair for the 2021-2022 committee year beginning July 1 and ending June 30th of 2022. And the membership or the people that are allowed to be selected as chair from the current membership: Amber Joyner, Leanne McCauley Larson, Misty Von Allen, Natalie Sanchez, Lorraine Benuto, Darren Balaam, Charlene Bybee. Jessica, I'm going to screw your name. Jessica's great. Jessica is great. Peg Samples, Elizabeth Flores, and myself, Scott Benton. So I'm going to turn it over to the commission.
I would like to nominate Scott Benton to continue if he would indulge us.
I, Lorraine Benuto, would like to second that nomination.
Thank you both. I would be honored to serve as a chair for another year. So with that, we have a motion and a second. Is there any other nominations before we open it up for public comment? No? Okay, we will open it up for public comment. Any public comment, America?
Not at this time.
Thank you. Seeing and hearing that there is none, we have a motion and a second. All those in favor, please signify by saying aye.
Aye.
Any opposed?
Aye.
Motion carries. Thank you guys for giving me that honor to serve as the chair for another year. It's been a fun year. Item 2.04 is the discussion and possible action to select a committee vice chair for the 2021-2022 committee year beginning July 1, 2021 and ending June 30th, 2022. From the current membership of Amber Joyner, Leanne McCauley, Misty Von Allen, Natalie Sanchez, Lorraine Benuto, Darren Balaam, Charlene Bybee, Jessica, who is great, Peg Samples, Elizabeth Flores, and that is it. So I'm going to turn it over to the commission and turn it up.
I, Lorraine Benuto, nominate Misty Von Allen as committee vice chair for the 2021-2022 meeting year.
I, Jessica Goguchia, second that nomination.
Thank you, both of you. Are there any other nominations before we turn it over to public comment? Misty, are you willing to serve as vice chair?
This is Misty Allen. It would be a pleasure. Thank you for the honor.
Thank you. And seeing and hearing that we have no public comment, we will call for the vote. All those in favor for Misty serving as vice chair of the 2021-2022 meeting year, please signify by saying aye.
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 Any opposed? Motion carries unanimously. With this, and I'm sorry, I'm going to turn it back over to legal to kick me under the table. Can we go back to item 2.02? I need to make an addendum to our agenda. To those that motioned and second the agenda, I would like to move item 2.07 to sooner in the agenda so that the presentation can be presented as our presenter needs to leave before 3 o'clock. She has a prior commitment. So if we can look at those that made the motion and second that motion, if we can make that amendment.
Chair Benton, is it for the Connect Washoe County presentation?
It is the 2.07 item.
I have 2.08, so just wanted to confirm.
Yeah, it's 2.07.
Okay, thank you.
Oh, wait. Nope, it's 2.08. You're right. Thank you. Paul has to leave the meeting. And then also, we are going to, sorry, this is my error. We are going to remove item 2.09 from the agenda until our next meeting. So with those two addendums to our agenda, can I get a motion to adopt the agenda based on those
This is
recommendations?
Misty Allen. I move to adopt the agenda with amended items 2.8 moving ahead and 2.9 being removed until the next agenda.
Thank you. Can I get a second?
I, Lorraine Benuto, second that.
Thank you so much. With those changes in the motion and second in place, is there any public comment now that I've opened it back up, America?
Not at this time.
Thank you. I have a motion and a second. All those in favor, please signify by saying aye.
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 Any opposed? Thank you. Motion carries unanimously. So with that, we are going to move item 2.08 and invite Jacqueline Kleinelder from the Children's Cabinet and Katie Metz from Renown Health, if she is here. Katie is on Zoom, on Teams. Awesome.
I'm
Jacqueline,
here.
the floor is yours. Thank you so much for coming.
I have a PowerPoint just to give you something to look at while I'm talking, because it can be. My name is Jacqueline Kleinedler. I'm a department director for the Children's Cabinet. Thank you so much for the grace of allowing me to move up on your agenda today. Thank you also for inviting me to give this presentation about a new initiative in our community called Connect Washoe County. The intent of this initiative is to support youth and families through community collaborations and linkages. So next slide. I prepared some notes, so I'm going to be doing a little bit of reading. Many stakeholders in Washoe County have documented the mental health needs of youth in our community, including suicide prevention and substance use intervention and treatment. Additionally, Washoe County has undergone immense population growth while continuing to have underfunded behavioral health programs. We consistently rank among the worst in the nation with regard to the ratio of behavioral health providers to population. Oftentimes, available resources for families are unknown, difficult to access, or have long waiting lists. These elements have been captured in YRBS data and in recent Washoe County community health needs assessments conducted by the Health Department and by Renown Health. Next slide. Following its 2021 community health needs assessment, Renown Health developed an implementation plan which includes priority focus on behavioral, youth, and adolescent health. Renown established a collaboration with the Children's Cabinet to begin work on 6 strategic objectives. So I'm going to read the objectives to you just so you can get a sense of what we're working on, but it can be a little complicated. So if you have some questions, let me know. So one objective is to strengthen networks of care for teens and adolescents and their families. The second is to combat death by suicide through the expansion of prevention, treatment, and family-centered support services. The third, to advance linkages of community support services, government, and health practitioners. The fourth, to strengthen and support interventions and programs by building creative and non-traditional care avenues. The fifth, to develop multi-tiered communication strategies that are centered around joint messaging. And the sixth is to improve and support data collection, analysis, and dissemination efforts for behavioral health needs. Our focus strengthens the effort of the most recent and nearly concluded Health Department's CHIP, which is their Community Health Improvement Plan. This project that we're undertaking is going to go on for at least 3 years, hopefully with some sustainability by the 3rd year. And so we're really picking up what is begun and continuing that effort. Next slide. So we've established partnerships with the Washoe County School District and Nevada's Office of Suicide Prevention to begin the work. These 4 agencies are invested in promoting and improving best practices and community standards around media, curriculum, and educational materials dealing with mental health and youth suicide. Next slide. We're using these guiding principles to maintain transparency and consistency as we begin connecting with other agencies and entities in the community. Trauma-informed, evidence-informed, and theory-based, family-centered, systemic, youth-focused, and equitable in terms of access and content of services. Next slide. So the 6 strategies that I read out to you a couple of slides ago, we're organizing all of those strategies around 3 goals that we've divided into each year of the project. So in this first year, our emphasis is on connecting with existing agencies and entities in the community that are already invested in youth mental health, in suicide prevention, in all kinds of ways. So it's not just therapy supports, it's also curriculum, it's social messaging around suicide prevention and youth mental health. And we want to create a network of folks who also know what other folks in the community are doing. So as someone walks in the door at the Children's Cabinet, for example, if there's a service that we're not able to provide, we know who is providing that service and resource because of this community linkage that is underway. We're working with the Washoe County Children's Mental Health Consortium on one aspect of this first step. So, for example, we're trying to build a website resource list for Washoe County providers, for Washoe County families that work specifically with youth and youth mental health. And we're hoping for that list to be something that providers themselves can log into and update as often as their programs change, so that school district staff and other community staff have immediate access to what's available, more readily available than the last couple of meetings where you heard about the last resource that someone had mentioned. In the second year, we're going to build on what we do in this first year and look for ways that we can identify and then fill gaps. And I think sitting here, we can all go, we already know where the gaps are. And so I don't think we'll be surprised at what is needed in that second year, but we'll have a good foundation and documentation and data to support expanding and filling gaps. And then in our third year, we really hope to embed what we create into our community so that it is owned by our community, it is supported by our community in a variety of ways, and then it becomes something that is sustainable after this initiative is finished. So what you see up on this slide are the initial contacts of folks with the Children's Cabinet, with the Office of Suicide Prevention, with Renown Health, and of course the Children's Cabinet. And I put some contact information in there if you have more questions. And then, of course, if you have questions now.
All right, we will bring it back to the commission for any questions, comments for Jacqueline or Katie.
Jessica Gogachia. Jacqueline and Katie, how will these services be accessed? Are they going to be through insurance, through school referrals? How would we connect with these kinds of services?
So we're really hoping to just map and get the resources to be known to folks. We're not really trying to create a different service that would require different insurance access or anything. So, for example, if the trauma grant funding that we had talked about a couple of months ago, if providers update their listing and they say that they have space available for those types of students, then that is how you would know that you could access that. If they don't have that, but they take certain insurances or they take Medicaid, then they could add that to their list, and that's how you would know that you could access. Not every service, though, is insurance-based, so there might be some curriculum resources that would be funded by grants or other projects.
And just to add on, as Jacqueline mentioned, in our second year, if we do find that there are specific gaps that we're seeing, such as maybe with services for families, that there's a lack of services needed, then we can also put out proposals for our partners to work on helping us provide those services and gaps through grant funding. So that is something that we'll be working on in the future as well. But just to reiterate, yes, this first year is just kind of finding what everybody is working on in the community and making sure that everybody is known of the various resources that are available right now.
Natalie Sanchez. Hi, Jacqueline. Hi. I'm curious, how was the best way for providers to get in touch with you all to get started with that process? Just an email or?
Mm-hmm.
Okay.
Yeah, so there's a couple of things underway, and we're just sort of slowly getting reach. So the consortium, for example, last week emailed the consortium listserv requesting that folks provide us kind of a baseline of who they are and what they have available in terms of services for families. And so my hope is that those folks will then forward that message to other folks, and that we'll start to get kind of a rolling influx of people who are interested in talking with us. But yeah, any interested folks can email me or Katie. We're the most directly involved in getting people sort of oriented to what we're doing and what we're hoping to achieve. But any of the folks in that email potentially could answer questions.
Oh, fantastic. Thanks.
Jacqueline, one of the questions that I had was for year one, we were talking about connecting with communities. The two things that you mentioned were supports in the community and messaging, correct? Trying to navigate through the supports that we already have, funneling them together, and then the messaging being unique and consistent, correct?
So one of our strategic goals is to offer feedback and support around social media messaging around suicide prevention, and that I think is what you may have heard around offering to give people some guidance and some information around the best practices for safe messaging around suicide prevention and talking about mental health with youth. So all 6 of those strategies we're going to be working on in all 3 years. With this first year, for example, around who typically puts out messages around suicide prevention, and how can we get connected with them and explain to them what we're hoping to offer to the community and get their buy-in to participate in Connect Washoe County.
Okay. Thank you for that clarification.
Yeah.
Any other questions from the commission? Awesome. Well, we will go ahead and close that item. Thank you, Jacqueline. Thank you, Katie, for
Thank you.
your time. And we will come back to item 2.05, which is the approval from our minutes from June 7th, the meeting of the Safe and Healthy Schools Commission. These meeting minutes were sent out in our email, so hopefully we've had a chance to look over them. Being that it is an action item, I'm going to ask if there's public comment.
No, Chair, there is none.
Thank you. And with that, we'll bring it back to the commission for action on the minutes from June 7th.
I, Misty Allen, move to approve the minutes of June 7th, 2021 of the
Thank
Safe
you.
and Healthy Schools Commission.
Thank you. Is there a second?
Hi, Natalie Sanchez, second.
Thank you. With that, we have a motion and a second. All those in favor, please signify by saying aye.
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 Any opposed?
Aye.
Motion carries unanimously. Next item on our agenda is item 2.06, which is an update on school opening efforts related to the COVID-19 pandemic, including mitigation strategies and other information released by the Washoe County School District. This is for presentation and discussion, and it looks like Dr. Lamarca is going to be the presenter.
Thank you, Chair Penton. For the record, Paul Lamarca, Chief Strategies Officer. This is a continuation of an item that the commission had asked for early last year, I think, just to be kept abreast of changes that are occurring within the school district. And so some of it will be familiar with some of you who have been part of the commission, and for a couple of you it might be a little bit newer. And really what I wanted to do is just, we've talked about a lot of what was going on, but there are some comparison slides in the presentation so that you can look at where we were in June, and now you can look at where we are now, and it's pretty drastically different. There are some guiding principles that we have tried to adhere to as we've reopened schools: do no harm, provide equitable access to schools or to students and families, meet the basic needs of families, continue to have high expectations, and do everything we possibly can to maintain safe in-person learning. Those have been the chief things we've tried to accomplish. Right before the beginning of the school year, I believe we started on August 9th, although I don't recall, but on August 4th, we received a new directive. Actually, days before that, I think we received 047, which was an important directive, but then 048 came out and it clarified some of that language. And this is where the governor reinstituted some of the measures he had taken previously, not all of those. Face masks were a critical matter as part of that directive. He did not reinstitute social distancing practices, but he did include a couple of sections of that directive that require us to do a significant amount of testing for COVID, especially around athletics and activities. And we'll talk a little bit more about that a little bit later in the agenda. And then it also requires those who visit our schools to adhere to the requirements within the school for being in person safe. So Directive 048 was really impactful for us. This is what, if you all remember, we've been using the Truckee Meadows Regional Planning Committee, their COVID risk meter, just to sort of keep where we're at as a community as a whole. And at June 7th, we were in the moderate range, and this actually continued to go down for a while. Can you switch forward? This was, so the risk meter is based on several indicators. Those are all on the left. It includes like risk assessments, which are really people that are interested in getting tested. How many people who seek a test actually test positive, rates of cases per 100,000, and some hospitalization data. And what you can see in this sort of trend line is really around April, we started heading significantly down south in terms of the intensity of the pandemic within our community. And about when we met, it was super low. We were under 4 for a considerable amount of time. And then we fast forward, and we're actually kind of in a, if you could go forward, we're starting to tear down again, but we've been now in the very high region for several weeks. Really, I think We hit the red, maybe our first board meeting in August, and we haven't come out of it since. The next slide shows you the trend line, essentially from about the time, well, it's in August. So if you remember the 2 slides back, we were down and around that 3 range. It pretty much stayed pretty consistently in July, and then we just headed up north big time. And we've been in that red region for a very long period of time. We will update the data for the Board of Trustees. Well, it has been updated, but we will take a closer look tomorrow morning because we'll get our next data download. We may be back in the yellow region, we may not be, but we are in a little bit better shape than we were just weeks ago.
Dr. Lamarca, can I ask a question? This
Sure.
is the community, not necessarily the school district.
Yeah, this is the community as a whole.
Thank you.
And we've tried to couch this as a community issue. It's definitely an issue for our schools, but our schools are inextricably linked to the community. I mean, when we, for example, have to send a child home, that impacts a family, and it may impact them economically. It may impact that organization in terms of their productivity. So these things are all interlinked. So from the onset, we have looked at this as a community issue of which we have a significant part. Part of the reason for maintaining in-person learning is to support the community as a whole. Could you go to the next slide? So again, here's the dashboard that we produce as a school district. We may be moving away from this, by the way, because the state's got some data tools that are maybe a little more consistent, especially when people are looking across districts, and it provides much of the same information. But back in June when we met, we were in the moderate range. 3.0 is a very low score. Average cases per 100,000, 3.17. Those of you who've kind of been following as we've been going along, Harvard sort of did an early study and claimed anything above 15 cases per 100,000, you're in really bad territory. So back in June, we were in good position. Test positivity, the World Health Organization wants that to be very low, definitely below 5.0. And then we provide sort of these middle 2 tiers, which don't have a lot of meaning for us right now. However, so this is June. So if you look at the exclusions, 4,734, just kind of remember that number in your head. And can we go forward? So this is year-to-date data within our school district. And you see at that top tier, we're way in the very high, it's actually very high region, 9.5. 37.17 cases per 100,000, and that's gone down significantly. Several weeks ago, I believe we may have gotten above 60. We were definitely in the 50s. Test positivity is down as well significantly, and that's a really important indicator. If you look at the exclusions, as of this date, we've already excluded more than 3,000 kids because of close contact. It took us at least till January to have 94 schools who'd been impacted by COVID last school year, and we never had more than 50 schools active at one period of time. But we have, as of this particular date, we had 85 active schools. What that means is that there was a student or a staff member who attended while infectious, which created exclusions, and that case is not yet closed. Once that case is closed, it's no longer an active case. So on the one level, this looks alarming. On another level, what it really tells you is how important social distancing was in the previous year in terms of keeping the disease down to a minimum. With so many more kids within the buildings, there is a lot more spread. We've gotten better at contact tracing. We're fairly precise with that. That has fallen largely to school staff. Washoe County Health District has not been able to keep up with the demand, so to speak. And so our principals, if you see a principal or a teacher, give them a hug because they're doing so much more than they ever signed on for. Next slide, I think. Oh, okay. So this is where we were. This is just another way of looking at this. This is broken down by age groups. I believe the yellow line represents the youngest children community-wide, that's 0 to 5 or 0 to 4. The green line is 5 to 12, I think, and then, or 5 to 11, and then the yellow or the orange line is 11 to 17, and then the blue line is the adult population. So you see way back in November and December, that was the peak of the pandemic for Washoe County. And then you see how it just really, I think that's probably around April, it really started going down, and we were down for a significant period of time. Can you pop the next slide up? And then you see where it went right back up. And we didn't get to the level we were at the very end of November, but we got to the level we were at the mid and end of December to a very significant degree. The good news is in the far right, where you see those lines continuing to come down. With vaccinations, with testing availability, with people adhering to face masks, we expect to see this to continue to go down. Next slide, please. Excuse me. So you guys have all been watching the news just like I have. And I know that there's a big push for vaccines, but not all people are choosing for vaccines. So from the federal level down to the state level, there have been some mandates in some locations, and then also strong encouragements to be tested weekly if you're not going to be vaccinated. This costs a lot of money, and so the federal government really is part of, I think, the suite of American Recovery Plan, provided grants through the state epidemiology laboratory. Capacity, I'm not sure, it's just a strange title, but anyways, we call it the ELC grant, and that's a grant that was given to departments of health and human services at the state level, and then they have in turn provided grants to school districts. We've received a large grant. We have availability for additional funding through that grant should we need it, and it's really been, it's potentially a game saver for us through it. It's multi-million dollars. I think Washoe County can be the district is eligible to up to about $12 million. So far, the grant that we've written is only around $7 million. So as needs emerge, we have some funding available. It is centered almost completely around testing, but it's also for the mitigation of the disease for those who've been impacted and those who've been disproportionately impacted. So we have been looking at ways to use the funding other than just strictly testing. So what you have is a set of bullets of some of the ways that we've used that money to date. We are in the process of hiring what we call clinical aides, and that we are adding a clinical aide, which is really part of the medical team within a building, to every middle school and high school, and a bunch of itinerant clinical aides at the elementary level. They would serve 4 to 5 schools. There's already a clinical aide in every building. We also, those are typically what we might consider part-time positions. They're typically around 27 to 30 hours. All those positions have been upgraded to 40 hours a week, and we have funding for that throughout the school year should we need it. So that's really helping with the impact on schools. We're able to hire some additional nurses. We only have, so we have, give or take, a little bit more than 100 buildings within the school district. We have, I believe, 47 nurses. So nurses are itinerant, and nurses, they get impacted by the disease as well and or other situations. We are hiring some additional nurses that basically serve in a rover role. They can go support schools as needed, and then if a nurse is out for an extended period of time, they will fill in and support that school. Something I believe we talked with you about a little bit, and this is really through Catherine Loudon, our counseling coordinator's leadership. We are providing therapist-supported peer groups for teachers and administrators. Those are weekly, or I think we may be doing a couple per week. And they're by choice. You don't have to go do this, but we're hoping people will take advantage of it. The demand has not been as great as you'd suspect, given what we hear from surveys regarding the impact on social emotional health. However, I think that's maybe more a matter of getting the message out, making sure people understand it's a safe place to go. And I don't know, I'd defer to you all, many of you who provide these sorts of services. It's a little daunting to get on a Zoom call, because most of this is virtual at this point, with people who you don't have trust with and you haven't met before, and then start spilling your guts about how this has impacted you. But we want to provide that, and if we're able to get to a point where we can do it in person, we will be doing that as well. And then, of course, substantial funding for the testing program. I think our next slide will talk about that a little bit. And then the final thing, and I'll talk about this slide, you can leave it, is we are about to start upgrading most of the water fountains, hopefully, within our schools to the touchless water dispensers. We're having problems such as this. Kids have to be outside as much as possible, and when they come in, they need water, but we don't have water as fluidly available as we once did, so most kids have their bottles. Well, that creates a line at what few dispensers we have, and then there's tardiness back to class, and there's interruption of instruction. So we're trying to, that is an example of an upgrade that we are being able to fund through this grant that's not testing specific, but it's clearly sort of a ripple effect of the pandemic itself. Okay, so in the governor's directive, he did have two sections regarding testing that affects school districts, and really Section 6 was the big section, and this requires us to test weekly any athletes or any students involved in activities and their coaches and their volunteers that are associated with those programs who will be traveling out of county for any competition or meet. Section 7 then required the NIAA, the Nevada Interscholastic Athletics Association, to develop language around what they consider close contact sports. Those are sports such as football, basketball, wrestling, and what they did through that is create a requirement to test on a weekly basis in order for a student to be eligible to test. That came to us again. If you remember the date of this, which I think it was August 4th or August 5th, we had football the next week. It was incredibly difficult to try to implement this. The first week of testing, we ended up excluding so many athletes that we had to cancel a bunch of games. And this is just because everyone's in contact. And then when you have a kid test positive, anyone who wasn't vaccinated because of rules had to be excluded. So we had to work with coaches on strategic ways to continue to support kids, make them ready for a next competition, but minimize contact at least for the first few days. And we did that successfully. We've got the exclusions down to almost nothing. Our Board of Trustees has, in almost every instance, adhered real directly to governor's guidance and CDC guidance and Washoe County Health District guidance. This is one area where they actually kind of were more restrictive. We all have heard of breakthrough cases. We've all heard of vaccinated individuals getting sick, and there was a fair amount of community outcry. Why would you just test unvaccinated athletes, not vaccinated athletes? So our Board of Trustees opted to, on a temporary basis, test vaccinated athletes to see how that went. We did that for about a month. We reported to the board the week before fall break. Very few vaccinated athletes actually tested positive. However, just having a couple test positive was enough for the board to try and continue that, at least for the time being going forward. So we are testing vaccinated athletes as well as unvaccinated athletes. I think that's it for that. Could you go forward? vaccination efforts. So one of the other reasons why I'm optimistic about the trend continuing to go down is vaccinations continue to go up. And we had partnered with Immunize Nevada and the health district, provided some locations for vaccination clinics during the summer, but we're doing that a little bit more assertively going forward. In fact, I think we have one this week, if not two. And bless you, assuming the Pfizer vaccine is approved for, I think, age 5 through 12, we may see even more of that, and getting, making it very accessible for our students and families to receive vaccines if they haven't yet made that choice. So that's a wait and see, but we are working hard on that. But we think as the vaccinations, that's kind of there's been a lot of public comment around face masks and vaccines and different things. All I can say is what I've read, and it seems about you're a fourth as likely to contract the disease if you've been vaccinated, and if you do get the disease, you're about a 12th as likely to be hospitalized with significant symptoms. And those numbers may vary study to study, but we think vaccines will help us remain safely in school throughout the school year. That was a lot of words, and I think that if you have questions, I'd be happy to try to answer them. I'm sure Dr. McNeil can as well.
All right, we will turn it back over to the commission for any questions. Comments? Dr. Benito.
Yeah, I just have a question. Have you observed, or maybe anyone observed, people having challenges in accessing testing?
Yes. Yes, we have. And Paul has just been astounding. I'm trying to organize all of this, as well as our entire COVID team. But yes, we've seen shortages of testing. It's actually, so I'm on a call with the superintendents across the state. It's actually an issue across the state as well too. And whether that's PCR or antigen, it seems that both of those are in short supply, most notably the antigen test. Did you want to add anything?
Sure, I can. It's a good question. I think like the mandates only require the testing for athletes, but you also saw that one slide where we're excluding 3,500 people. And there are ways to test out of exclusion, and that's just been incredibly hard for some families because of the lack of tests. We do allow the rapid antigen tests as long as they've been administered by health professionals to be used in that kind of an instance. I mean, you're symptom-free and then you have a negative, but they're just not available. The current testing program we've been using is based on rapid antigen testing, and it's not probably sustainable. We will likely shift over to PCR testing. The big unknown and curiosity with that is there's a longer delay in reporting, so some of the ability for us to narrow down contact before getting a result goes away with that, so there may be more exclusions. The one thing I'll say, at least about athletes, is once they know they're going to be tested nationwide, they're doing a pretty good job about complying. Their test positivity rates are like below 1%, so it's pretty amazing. I think, and we have had lots of conversations about it, we're trying to provide opportunities for students and staff who've been excluded. So we're trying to figure out ways to set up some regional sites that would occur a couple of times a week in different parts of the city, so that, because your day doesn't always land, perfectly. You gotta, I don't know if you guys know the rules, but if you are excluded after 5 days, if you're asymptomatic, you can test out. Well, what if there's not a test available on day 5? So we're trying to figure out ways regionally to make that happen, but it is challenging and it will be very expensive.
Thank you.
Dr. LaMarca, I have 2 questions. Earlier, and I don't know if Catherine might be able to help too, when you were saying about the therapist-supported groups, what needs to happen for these to be able to be in person, even if they're small in-person groups? If that's something that you guys are potentially looking at as a barrier, is that getting on a Zoom, a lot of people you don't know, talking to a therapist on the computer? Have you guys looked at what that might look like or offer?
On that question, and I'd invite Catherine to come up if she has some ideas. It's hard because we have talked about that. So for example, our parent university classes, which is different than therapy, but those are much better in person as well. And people want to get into a room. What we have been doing is staying digital unless you absolutely have to be in person. And if you're in person, then you have to provide space where you can have 6 feet of distance. You can kind of make sure you're not going to create any health risks for individuals. The problem with that, with our current funding, is that this is available to all staff throughout the school district, and we really don't know in advance who's going to show up.
Yeah, thank you for the record. My name is Catherine Loudon. Commissioner Gokichia, I just wanted to say that I can say that. Actually, I mean, the whole purpose of this was to remove barriers for anyone, any of our staff. So the most ideal situation would be if staff had a choice, because there are people who want to be on Zoom, and that's most convenient for them and their families and their schedules and their lives. And then there's people who are more comfortable in person. And so the fact that it's just it's an open door Zoom policy, it makes it difficult to establish, as Dr. Lamarca mentioned, that rapport and get people going and coming. We're collaborating with the Washoe Education Association and other groups in that outreach to help it be more successful. But we're trying to make it so that it's as easy as possible, given a variety of options for people to attend. And it's just there's having it open and not having any idea how big the group could get becomes a venue, and it is a small group setting at this juncture.
Thank you.
Just a quick comment on Zooms and doing therapy. That the data that I've read recently, at least on individual sessions, I haven't seen it for groups just yet, but the data that's out there shows that individual therapy is just as effective, if not more in some cases, on Zoom. So I think you're right on with having, the availability at least, because then it does allow people to pop in if they have a chance, and it makes it more accessible. So that's great.
I was wondering, I know of my high school specifically, I know many students probably struggle with it, but I know my high school has a big issue with it around students wearing their masks properly. And I was wondering, we've had a few COVID scares, but I was wondering, how are we supposed to be is the district holding teachers accountable, or is it just principals holding teachers accountable? Because I've seen a lot of either teachers are trying to enforce students to wear them more, or certain teachers are just saying you don't really have to wear them in my class, or you don't have to wear them properly, or just not providing any guidance.
That's a very good question, Ivy. There's sort of two answers to that. There are tools that should be available to help schools kind of hold students accountable, and principals are the frontline staff to hold teachers responsible. We publish a for lack of a better term, a behavior manual every year that lists out our expectations, and there's a special section in there that talks about adherence to COVID mitigation strategies. So especially at young age, a child just may developmentally have a very difficult time, and the mask may slip, and they may not know that they can keep it on when they talk, a lot of things. And so there's definitely an emphasis on re-education, but as kids get older, that's less of an issue. And so if there are repeated instances where they're not complying, the school does have some ability to address that with parents and with the student. Up to suspension, up to asking them to be on some sort of digital format. Obviously, we are trying to balance that with maintaining, in-person learning. It's bad to hear that it's not happening with some teachers than it is with others. One of the main duties we actually see for these clinical aides that will be in all the secondary schools is just constantly walking the building when they're not actively doing contact tracing. I say that because if they can go in and observe classes, that may help with some of that accountability, like, well, this person's going to come in, they're going to be able to tell the principal that kids aren't adhering. The more important thing is just to have confidence that kids are wearing their face masks. And I say that because there was a change in guidance that was allowed from the CDC on down, that if you all remember, if you're within 6 feet and you're a close contact, you have to be excluded. Well, there's a special exception for classrooms where between 3 and 6 feet, so long as everyone is wearing masks who's been affected, you don't have to exclude. But we have to have confidence in that. And so I know what school you go to, so we'll try to follow up with this school. But it's a tough one. I don't know, Dr. McNeil, if you have anything you want to add.
No, you answered it perfectly, and we'll follow up with that. But that's, Dr. Lamarca did a great job. It's really, it's a team sport here, and so we ask our principals to be, because they're on the front lines. But then also it's the responsibility of all of us, and that's what we keep on saying, is that it's all hands on deck. So Paul has been in schools, I've been in schools, I've talked to some eighth graders that say you need to pull it up. And typically, they do just fine. They do just fine with that. So we really haven't had too many issues here in our district. I'm really proud of that, about mask non-compliance.
I love to hear that. When I discuss it with Victoria Gomez and everything about what's happening at Worcester or other schools like that, and to hear that students are really complying with it, I'm usually shocked. And I will say at my school specifically, there was a lot of motivation around, because our clinical aide took up a new position, so now we don't have a clinical aide. And that was just announced over the loudspeaker like 2 weeks ago, that if we have COVID-like symptoms, to think twice before we go home, because we will be sent home and there's nobody to really deal with it. And then the other thing, they were trying to enforce a lot of COVID guidelines. So our dean was walking around the building and stopping in at different classes. And I was in one of my classes that usually is not, has a lot of people who are not wearing their masks. And I knew that the dean was walking around, but we had a different teacher watching over us at that time who was very enforcing of masks, because they have their own health issues. And so they're very protective over that. And I was like the most I'd ever seen a teacher really trying to dial in on kids to try and keep them up and wear them properly. And the dean walked in and she was like, "You're the first class I've seen everyone has had their mask over their nose and mouth." And so she then started to bribe kids with candy, which really motivated them. But since then, every day it's kind of like the same thing. But that day I was like, wow, I'm really proud of this school right now. But yeah, M&Ms can go a long way for a lot of kids, even high schoolers.
Thank you for sharing, Ivy. It's always great to hear what's happening in our schools. Thank you. Any other questions, comments from the commission? No, we will move to item 2.07, which is the discussion of planned use for federal funds to support students and staff related to mental wellness. I'm going to toss it back over to Dr. Lamarca.
Hi. Again, for the record, Paul Lamarca, Chief Strategies Officer. We had presented to you in June some of what we had hoped for in terms of some extra positions. And when I'm talking about this, I'm really referencing positions that are mostly around health and safety and social emotional health in particular. I'm not talking about direct academic supports, because there's been an awful lot of funding provided to sort of buttress learning loss. We had a very successful summer school. We have we think, successful tutoring programs going on within our buildings right now. But more around the content that at least was part of the context of this discussion. We were able to extend the number of staff members who are responsible, or their primary responsibilities around attendance and re-engagement. So we have 4 to 5 positions, I think, of people that are actually out visiting homes and making sure kids are attending school, and we're at a point now. So at the very beginning of the year, that's really heavy just on attendance, getting kids to school who haven't yet shown up. Once the school year goes on, then we have students who've been out for a long period of time, and a lot of that work shifts more to what we call re-engagement. So we try to find out what has been the big barriers to coming, and then inviting them back in and trying to address those barriers. So that's been very helpful. In Catherine Loudon's area in counseling, and we are waiting approval from the State Department of Education on this, but we were approved by Dr. McNeil and our board and our constituent group that was reviewing applications to hire a counselor on special assignment to oversee substance abuse or substance use needs, which are vast within the school district. And that position will likely last for about 3 years once we get it hired, which we're waiting on any day for the Board of Trust, or for the State Department to approve our application. Through Catherine's department, we are also expanding suicide prevention work, some of with the Children's Cabinet. I think you've received a presentation in the past on signs of suicide screening and curriculum. Our district largely is responsible for the curriculum pieces of signs of suicide, but the Children's Cabinet comes in and helps with screening. All 7th grade students in the school district are screened. Sadly, through that process, we identify about a third of the students, a little bit more, as being at significant risk for depression and or suicidation. We are also looking at a program called Living Ideation, which is more of a support kind of a focus, especially for families who've experienced this, and hopefully actually prior to experiencing the urgency. And we are trying to stimulate interest in that. I think we're supporting that for all of our high schools and middle schools. It's a little bit like the peer groups, hasn't been well attended yet. We received approval on some additional family graduation advocates. We have in most of our secondary schools and many of our elementary schools, especially title schools, we have family graduation advocates. These are essentially a staff member that really supports students, but supports the engagement of families in supporting the student within the building. These people are great, and they're largely responsible for some of the gains we've seen around graduation, especially with traditionally marginalized groups. So we will hopefully get approval of that, and we'll be adding several of those positions. And then we also we received approval for a mental health administrator. We have school psychologists throughout the district. I think we have 48 school psychologists. So like nurses, they're itinerant. School psychologists are primarily responsible for things like special education assessments when we find that a child may have some needs. So they get embroiled in that kind of work. They're all not skilled or licensed to provide mental health support. We only have one mental health administrator right now. That's Dr. Betsy Sexton. We're trying to grow her by one additional staff member. And I will tell you, I don't have good trend data, but the needs are vast. We've received, I think, and this is just within our school district, we work with many partners like Dr. Benuto and Ms. Sanchez on co-locating services. But we've received in the last month 18 referrals for mental health assessments, and it's just too much for one person to do. So we're desperately waiting to be able to hire that second position, and again, we're waiting for the state to approve that particular grant. I did mention that, academically, I think a lot of money has been invested, and that's for all the right reasons. And I think, actually, I think Ben Hayes is the one who named it, but through Kristen's leadership, We used this money for what we called Raleigh grants. I don't remember what Raleigh stands for, but I do know that Ben is the one who named it. But what I thought was very promising is within the Raleigh grants, many of the schools selected an additional counselor or an additional social worker or people focused around family engagement. It wasn't, they are seeing the linkage between sort of climate and social emotional learning and wellness with academic outcomes. And so that was very positive. That's all I have for that item.
Any questions, comments from the commission? All right, well, I'm going to toss it back over to you to item 2.10, which is discussion of bell time survey and possible adjustments to school start and end times.
I promise you in the future there will be different presenters for most of these items.
Share the responsibility.
It's amazing how we haven't had our first meeting till October, and this meeting still snuck up on us. That's how busy I can say we have been. I think this is a very interesting item, though, and what I would encourage you, and I'll send this to you, or I'll send it to America. Maybe we can get you all the link, because we have a community survey that's in the field right now to adjust, to consider adjusting bell schedules, the times at which kids start school and leave school. For years now, I don't know for how long, but I think maybe forever, middle school has been starting at around 7:30 in the morning and soon after high school starts, and then 8:30 to 9:30 in that kind of range, elementary schools get underway. And there's more and more research that suggests that, especially among middle schoolers, they're up all night. And so getting them up real early to learn is just not, especially beneficial. And there are some outcomes associated with adjusting these times. Probably fewer less tardies, better attendance, eventually better graduation rates, but also some kind of health issues like fewer accidents occurring due to sleep deprivation. So the survey that the Board of Trustees worked with staff on getting out, I think it's open for another week or so. I don't remember the exact deadline on it. It provides like 6 alternatives to the current schedule, and you can go through and you can choose it. I think under any scenario, we're hoping to move the start time back a little bit. So at the earliest, people would start at 8 a.m. But there are choices on who should go to school earliest. And intuitively, it might be elementary kids because they're just always energetic whenever they wake up. Some elementary students rely on older siblings when they go home. So there are things to consider, but you can answer the survey as a community member, or if you have kids in the district as a parent, or in my case, I answered it as a staff member, that kind of a thing. So we'll get the link out to you. I believe the Board of Trustees is reviewing the data on October 26th. I don't know that they will act on that date, but they may. And I don't know how that item is written, if it's an action or just information at this point in time. But we do anticipate changes. In addition to choosing the schedule, there are questions that provide you an opportunity to say when it should occur, like immediately, as soon as possible, or wait 2 years, in case you have a someone who's going to, whatever, self-interest. And then there's a open text box where you can put in comments. Dr. McNeil, I don't know if you had anything to add.
No, you did great. And all I would add is that, and depending on which option is available, there's a cost factor to that, because you're either going to be adding routes and drivers or adding buses. And, it looks real easy. Why can't you all just have one time? Well, we only have 335 buses. So that's where the staggered time comes in. And so part of that is the cost factor as well, too. And that has to be taken into consideration.
Is there a budget?
Nope, go ahead.
Is there funding and budgeting available for that cost factor? Because when I looked at the survey, some of those options were really, really expensive.
And that's why we would be bringing this forward so early, because it needs to be built into the budgeting process. Whatever decision the board decides to take, it needs to be built into that. Yeah.
Thank you.
That was my question. Thank you. What does it look like in the budget? It's not there yet.
Not there yet.
Any other questions from the commission? All right. That concludes all of our discussion items under item 2. So we will go on to item 3, which is our closing items. Item 3.01 is public comment. Due to the current state of the emergency declared by our governor, members of the public wishing to make public comment on an item on the agenda must submit their comments via email. Any public comment received will be forwarded to the staff or to the Safe and Healthy Schools Commission for its consideration, with being consistent with the emergency provisions noted above. Other than the email that we received with our agenda packet, was there any other email public comment, America?
There has not been any other than the one from Mr. Morabito.
Morabito, thank you. And is there any public comment since the meeting?
No, Chair, there is not.
Thank you. All right. Item 3.02 is our next meeting announcement, which is Monday, November 8th. It'll be held here in the boardroom at 425 East 9th Street. And with that, it is 3:05, and I will call the meeting adjourned.